nosocomial infection, nosos come from hospitals, basically deal with hospital acquired infections, and they are what we would ascribe to a patient coming in, say, for a surgery and then going back, or getting an infection within the hospital and then going back with something he didn't anticipate at all.
Earlier, this infection and all remained confined within the domain of clinicians and the nurses. But today, being a hospital administrator, I can see it can play a havoc in a hospital. When you are managing a hospital without much infection, especially in the ICU and all, it reduces the hospital stay for the patient. It helps patients to get a lesser stay with a reduced bill amount, which is good in terms of the outcome.
And today with the advancement of medicine, we are keeping our patients alive in ICUs for much longer. We are immune suppressing them with transplant, with oncology, and so with that comes a huge burden or a huge responsibility for the hospital to prevent them from getting nosocomial or hospital acquired infection.
Sometimes these infections in the hospital can completely turn away the focus on patient care from one disease to the other disease, other episode of sickness. So this infection control week is a practice here for more than last 25 years. We in this hospital since the beginning have given a major focus on patient safety.
In 1994, even our trustees, they were so aware of this. They were happy to support us and visibly come out and support us, that infection control is really important. So that's when we started having a IPW, that's Infection Prevention Weeks, way back in 1994.
We have in our hospital a very strong infection control team, which is not managed by only a microbiologist, but we have infection control nurse. We have doctors from the medical as well as surgical side who are part of it.
So this whole week we speak to every employee that is concerned with healthcare, and we've divided them into 4 groups: the doctors, the nurses, the technicians, which include lab, AKD and respiratory, and we also speak most importantly to the housekeeping.
So we felt that unless and until the healthcare workers, so by saying healthcare workers, I not only mean doctors and nurses, even the housekeeping staff, even the dietitian, even anyone, whoever is directly, indirectly linked with the patient care, how they can be trained and how they can contribute for the improvement of the patient care.
So we get the directors of them involved, and they percolate it down, and we have the identical program on every day of the week, so that somebody's on night duty, some may be on a different shift. We ensure that they all come, and so in order to encourage them, we have quizzes, we have skits. We don't make it boring, So the thing is, it's a dry subject, and people get a little fed up, and so we make them participate. We make them do the skits, and we see that the content is good.
So basically IVR is a digital platform, the technology. Today many things what we do, we adopt, and we find it difficult to monitor, measure, record, and looking at a longer horizon. So what IVR will do, it will help us, especially the infection control team, to monitor, record and manage those data, document. They can find out the kind of progress, improvement we are making. They will help us to identify that where we have problem, what kind of improvement is required in which kind of unit. So all this will be done in a very systematic way in the digital platform, and hopefully soon we will be also able to get some sorts of benchmarking practices from the other organization who are following best practices.
We are hoping that the infection control nurses will now be online at par, and they'll go with their iPads, and they'll see currently everything is being done manually. We're calculating our rates manually, we're calculating our various device associated rates, our hospital acquired rates are all being done manually. And with that, we actually do a surveillance that plots on a daily basis how many infections we have and what type of infections we have, so that we can quickly go in and do it. This will just enable it much better. We have an infection control surveillant, We have our infection control nurses, we have an infection control officer, and from microbiology there's a lot of input that goes into infection control every day. We meet every single day. Plus it's an online, so it calculates on a daily basis. Here we may be doing it once in 15 days or once in a month. It will clearly be a step in the right direction to monitor with integrity and with accuracy.
Now this entire thing is like a chain, right? And when you do each one of these things well, you're preventing infection from happening. If infection happen, you are quickly treating, right? You're monitoring and making sure the patient gets off and goes home quickly, so your average length of stay reduces. Now this is where we brought in technology, right? So the reason because you need to at least know what's working well, right? And if you at least know where you are, then you can bring some improvement.